What's important is that people are not only given a diagnosis, but they're part of that diagnostic process being made. So it's not just about knowing a fact, it's about the whole process of diagnosis. And a good memory service will do this well. And there are three elements to what that service should do that will be helpful to the individual and to the individual's family. So the first is about making the diagnosis well. And that's not just saying that someone's got dementia, but it is thinking about what the subtype of dementia is, what causes that dementia, what are the treatable elements within that dementia, and in order to be able to give people clear and useful information that people can act upon. So the first part is making the diagnosis well. The second part is communicating that diagnosis in a sensitive and in a useful manner that empowers people rather than shocks people. And there is good evidence to suggest that if that is communicated well and communicated to the person with dementia and to the family at the same time, and there is the chance to discuss it, then people end up being less anxious and less depressed than they were beforehand when they were troubled by those symptoms, because knowledge is power, essentially, and the knowledge of what's going on with you and your family is terrifically important. So a good memory service will not only make the diagnosis well, but it will communicate that diagnosis well and sensitively. And the third element is that one then needs to be given the information and the support that you need to be able to start out on the journey with that illness. It is bad news being told that you have dementia. Nobody wants to have dementia. It's a devastating illness. But there is a tremendous amount that can be done to enable people to live well with dementia. And that's the third thing that a memory service should do. The third thing that a memory service should do is to empower people through giving them information, through generating a care plan, identifying the problems that individuals have, and identifying solutions to those problems. And that may include medication for the dementia, but it may include also social support and educational support. And it may well include planning for the future and thinking about what may be needed in the future, because with the dementia you may be living 7 to 12 years with that, and you need to be able to come back to that service in order to be able to be signposted to other services and other things that you might need later in the illness.